July 20th, 2014, Lagos, Nigeria, Murtala Mohammed International Airport. A man collapses in the arrivals hall. They load him into an ambulance. He is sweating, vomiting, feverish. He tells them it is malaria. He has just flown in from Monrovia, Liberia. He does not tell them that his sister died of Ebola 3 days ago. The ambulance pulls up to First Consultants Medical Center on Victoria Island, a private hospital where every government doctor is currently on strike. Inside, a woman in a white coat is finishing her rounds. She has worked here for 21 years. She is the lead consultant physician and endocrinologist. Her name is Dr. Stella Ameyo Adadevoh. She does not know it yet, but in the next 4 days she will make one decision that will save 20 million people, and it will kill her. But to understand what she was holding, we have to go back to where she came from. Stella Ameyo Adadevoh is born into a family for whom Nigeria is not abstract. It is personal. Her great-great-grandfather was Samuel Ajayi Crowther, the first African Anglican bishop, captured into slavery as a boy and returned to his continent as a scholar who translated the Bible into Yoruba. His grandson was Herbert Macaulay, founding father of Nigerian nationalism, who started the first Nigerian political party in 1923. His face is on the 1 naira coin. Her maternal granduncle was Nnamdi Azikiwe, the first president of Nigeria. Her father, Babatunde Kwaku Adadevoh, was a physician, vice-chancellor of the University of Lagos, and an advisor to the World Health Organization. 4 generations, 1 bloodline, a family for whom building Nigeria was not a metaphor. She could have coasted on that name. She could have let the lineage do the work. Instead, she became a doctor, not a ceremonial doctor, a working one. 7 days a week by choice for 21 years at a private hospital in Obalende, Lagos. Endocrinologist, lead consultant physician. The person you called when no one else could figure it out. But here, this is where the story turns. In 2012, swine flu reached Lagos. Stella Ameyo was the first doctor in Nigeria to diagnose it and alert the Ministry of Health, not the government, not a specialist task force. One doctor, pattern matching at the bedside, who looked at a patient that other people had labelled and decided the label was wrong. This was her particular gift. Not brilliance as performance, but the kind of rigour that does not stop questioning until the question is answered. Less than 2 years later, it would save a country. On July 20th, 2014, a very sick man named Patrick Sawyer collapsed at Murtala Mohammed International Airport in Lagos. He had flown in from Monrovia, Liberia, where he had recently been in contact with his sister, who died of Ebola. He was an ECOWAS official on his way to a conference in Calabar. Under normal circumstances, he would have gone to a government hospital, but Nigerian government doctors were on indefinite strike. He was taken to First Consultants Medical Center in Obalende, where Adadevoh was the lead physician. The first doctor who saw him diagnosed malaria. Adadevoh came in on her ward rounds the following day, and something in the picture did not fit. But actually, the most important decision had not yet been made. She asked Sawyer the questions the first doctor had not asked. She asked him about Liberia, about who he had been near, about the specific quality of this illness. He told her it was malaria. He insisted he had a conference to attend. She contacted the Lagos State and Federal Ministries of Health and ordered an Ebola test. While she waited for the results, the pressure began. Sawyer himself demanded to be discharged. The Liberian embassy officials arrived and escalated. The word kidnapping entered the room. Legal threats followed. She was holding a man against his will with no confirmed diagnosis. Only her clinical reading of a pattern she had never physically seen before in 21 years of practice. You know this moment, the one where every reasonable argument points toward letting go, the one where the easier thing and the safer thing, if for you, are the same thing. And the harder thing is the one nobody will thank you for if it turns out you were wrong. She looked at the room. She looked at Lagos outside the window. She said 4 words: for the greater public good. Most doctors stop the story here. The story does not stop here. The test came back positive on July 23rd. Ebola had arrived in Lagos, in a city of 20 million people, in a country where government hospitals were closed, in a private clinic with no isolation ward and no adequate protective equipment for a hemorrhagic fever. What she had was a wooden barricade. She had it built outside Sawyer's door, the only physical boundary she could create between him and the rest of the hospital. And then she got to work. She alerted every relevant authority. She organized contact tracing before it was asked of her. She informed her colleagues of the exact nature of the virus, the transmission routes, the symptoms, the protocols, because the hospital had no training for this. She sourced what protective equipment she could find. Sawyer was agitated. He pulled out his intravenous lines. He moved through the room. Blood reached surfaces and staff. She stayed. Sawyer died on July 24th. Adadevoh's team had contained him for 4 days with planks of wood and will. But here is what that containment had already cost. On August 4th, 2014, 15 days after Sawyer collapsed at the airport, Stella Ameyo tested positive. She was moved into quarantine. The same protocols she had enforced for her patient were now enforced for her. She had a husband, Afolabi, a son, Bankole, a hospital of colleagues, some of whom were also now testing positive, 11 healthcare workers in total. The system that arrived in a body had spread through the gaps between the wooden barricade and the virus. What she did in quarantine is not extensively documented. What we know is that she did not break. She had built a chain of action that was running without her, because she had built it to run without her. Outside the quarantine ward, something extraordinary was happening. The Nigerian government, moved to action by her initial report 2 weeks earlier, had set up an Ebola emergency operations center. Contact tracers were working. Every connection to Sawyer was being mapped. All 20 eventual cases in Nigeria traced back to a single chain. One chain. Because one woman had held one door. She held it until she could not hold anything anymore. August 19th, she was gone. 57 years old, the first and only doctor to die of Ebola in Nigeria. Her body was cremated by the government. Infection control protocols applied even to her death. Her family received her ashes. A private ceremony September 12th. She had held the line for 30 days. The Nigerian government continued to hold the line after her. The emergency operations center she had triggered became the command architecture for the entire response. Contact tracers followed every thread. 20 cases, 8 deaths, no more. On October 20th, 2014, 93 days after Patrick Sawyer arrived, the World Health Organization declared Nigeria Ebola-Free. Nigeria Ebola-Free, because one doctor in Obalende built a wooden barricade, said 4 words and held her ground until she had nothing left. Think about the family she was born into. Bishop Crowther returned from slavery to build something. Herbert Macaulay, who started a nationalist movement and died before independence arrived. Nnamdi Azikiwe, who inherited the mantle and became the first president. A father who spent 30 years in service to a health system that was not ready for what she would face. Each of them had a moment when they could have chosen the easier option. None of them did. What you inherit from people like this is not their titles. It is the muscle memory of choosing hard. When your moment arrives, and it will not need a speech. You will not need a plan. You will just need to know what you are holding and why it matters, and refuse to let it go. Their courage is your inheritance. Come and collect it.